Mr. Speaker, I claim time in opposition to H.R. 1181 and yield myself such time as I may consume.
30 minutes.
Thank you. I recently joined the Committee on Veterans Affairs because of its bipartisan history of working together to improve care for our veterans. And I stand ready to work with the committee, in particular with Chairman Rowe and with every member of this House, to improve and work on the important issues that affect our veterans every day. However, I cannot support this bill, and I strongly urge my colleagues to oppose it. As this House knows all too well, there is a veteran suicide crisis in this country, a crisis that is enabled by the easy access to firearms. Just last week, the Secretary of Veterans Affairs, David Shulkin, told the House Committee on Veterans Affairs that the issue of veteran suicide is one of his #1 priorities, and it needs to be a priority of this House as well. Today, on this day that we have this debate, 20 brave men and women who have worn the uniform in service of this country will take their lives in suicide, and the vast majority of them will use a gun. As folks all over the country who have helped veterans know, the means matter. Research has shown that more than 85% of suicide attempts with a firearm are ultimately fatal, compared with just 5% with any other means. And that's why addressing the public health crisis in the veterans community demands a thoughtful and comprehensive approach to ensure that veterans in crisis do not have easy access to guns and that they get the care that they need and deserve. And yet today, this House is voting on legislation that completely ignores the crisis that many of our most vulnerable veterans are facing. Unfortunately, this bill was rushed to the floor with no consideration in committee, collaboration, or even time for all of us to understand its full implications. The majority scheduled H.R. 1181 for a vote in committee last week, with the bare minimum notice required, even having to move the start time of the markup to comply with the 48-hour notice requirement. During last week's committee markup, I raised the concern shared by many who work closely on this issue that H.R. 1181 would end up being applied retroactively. The result of this bill being applied retroactively would mean that if it should pass, more than 170,000 veterans currently prohibited from owning a firearm would be able to pass a background check and buy a gun. While the chairman expressed his sincere intent and desire that this legislation not be applied retroactively, it's fair to say that reasonable people disagree on how this bill would be implemented. This honest disagreement alone illustrates exactly why this House should be taking its time on a bill that could have such a profound impact on our nation's veterans. The fact of the matter is that should H.R. 1181 be signed into law, it would need to be read together with the NICS Improvement Amendments Act of 2007, which requires federal agencies to update the records they have previously shared with NICS. Meaning, should this bill pass, the VA would be required to remove the 170,000 records they've previously shared with NICS, since none of those was approved by a court, nor did they meet the new standard established by this bill. Now, with respect to the text of the bill itself, the Veterans Second Amendment Protection Act, contrary to its name, would create an end run around the firearms mental health prohibitor that we have attempted to refine and improve since Congress passed the Brady Act nearly 20 years ago and the bipartisan NICS Improvement Amendment Act of 2007. Put simply, this bill would make it easier, not harder, for those veterans in crisis to get access to a firearm by establishing a new judicial requirement that is far higher than any other agency or department's implementation of the firearms mental health prohibitor, and quite frankly, would be impractical, if not impossible, for the VA to actually use. The VA is already strapped for resources, and it is unclear if it has the legal standing to initiate a legal proceeding such as that suggested in the bill. As members of this House know very well, there has been a fierce debate in this country over the meaning and extent of the Second Amendment right to bear arms. But the question before this House today is not whether an American has a right to own a firearm. The Supreme Court has been very clear on this issue, and the controlling law has been settled. However, constitutional rights are not absolute. As the late Justice Scalia in the controlling Supreme Court Heller decision on the Second Amendment, quote, "The Second Amendment is not unlimited," close quote. The question before this House is whether we are going to summarily overturn the VA's efforts over the last 20 years to help prevent veteran suicide and protect veterans' families by reporting the names of veterans with serious mental health issues to the National Instant Criminal Background Check System known as NICS. Supporters of this legislation argue that the current process used by the VA to share mental health records with NICS is over-inclusive, must be thrown out, and replaced with a process that ensures veterans' due process rights. I agree that the current process is over-inclusive, and I agree that we must do more to ensure veterans have sufficient notice, an opportunity to be heard, and a meaningful opportunity to appeal any decision that may impact their constitutional rights. And I stand ready to work with my colleagues on the committee and in this House to more specifically tailor the application of the firearms background checks law as it applies to veterans, both prospectively and retroactively. But a wholesale elimination of the VA's long-established practice to help keep firearms out of the hands of veterans who are at serious risk of harming themselves or others is dangerous and misguided. To be clear, of the 170,000 veterans currently prohibited from owning a firearm, as of 2015, almost 20,000 of them were diagnosed with schizophrenia, over 11,000 with dementia, and over 5,000 with Alzheimer's. For a veteran suffering a significant mental health condition, like one of these, access to a firearm is a serious matter. Moreover, just 3 months ago, this Congress passed bipartisan legislation that codified a process for how the VA can make a determination of the mental capacity of a veteran before that information is sent to NICS. The 21st Century Cures Act, which passed this House 3 months ago by a vote of 392 to 26, required a veteran to be provided notice of a proposed financial competency determination and given an opportunity to be heard, present evidence, and be represented at a hearing. H.R. 1181 seeks to undo this carefully crafted compromise before we even have a chance to study the impacts of the 21st Century Cures Act or the VA's existing practices. Mr. Speaker, at this time, I would like to ask unanimous consent to submit for the record a letter signed by 12 veterans, including retired Generals Stanley McChrystal and David Petraeus, whose leadership and support for our military and veterans community is unquestioned, and who believe that this bill could put mentally ill veterans in harm's way by giving them easy access to firearms.
Without objection.
Thank you. And, Mr. Speaker, I would also like to ask unanimous consent to submit for the record a letter from Everytown for Gun Safety and a coalition letter led by the Newtown Action Alliance, signed by over 40 organizations from around the country opposing this bill.
Without objection.
Finally, Mr. Speaker, I would like to ask unanimous consent to submit for the record testimony from Brigadier General Stephen Xenakis, Dr. Jeffrey Swanson, and Richard Bonney, who were prepared to testify at a hearing that was canceled on a similar bill before the Veterans Affairs Committee